All righty. Good morning, everybody. Welcome back to Compliance Capers, another exciting episode. My name is Sonal Patel with SP Collaborative, and I am sitting with my good friend, Betty Hovey with CHCS Consulting. I know it's been a minute since we've been on, but welcome back, my friend.
Hey, good to be back again to talk about some more compliance issues. And I just want to say hey, y'all, to everybody else. So good to see what we're going to get into today.
That's right. That's right. So we had a little hiatus last week. We played a bonus episode for everybody to dive deep into corporate integrity agreements because that was our focus for the entire month of May. And I know our very first episode was almost an hour long because we did cover a lot of material in that session. And so we had figured that a bonus replay of that episode while we were both out enjoying the month of May for a change, right, would be welcome by our audience. So I hope all of you took the time to really go back and hear that session in its entirety because I think it was a really, really good one. But, to carry forward with our theme for the month on, continuing compliance, avoiding compliance capers like this, we found another corporate integrity agreement, again, one of the smaller ones known as a integrity agreement that had to do with a pharmacy out in the state of Pennsylvania. So let me go ahead and pull up that DOJ press release link for the audience to go ahead and pull up at your own time, take a look at it, because again, like we've stated throughout our Compliance Capers episodes from month to month, these things are public pieces of press release. They are available for all of us to review at our leisure, and this one happens to deal with literally a pharmacy in the state of Philadelphia. It was issued back in January 2024. So, Betty, if you wouldn't mind reading to the audience a little bit more about what this particular press release actually involves, what was kind of at issue here with this particular entity?
Sure. In this one, as Sonal said, it is about a pharmacy that was in Philadelphia, and the current owner of the pharmacy, he agreed to pay over $4.6 million for settling some False Claims Act liability because they state that they gave prescription medications or billed for prescription medications that they didn't actually give. That was one of the things that, they said. So patients never got these drugs, but they were billing Medicare and Medicaid for them. And then they also say that they do those formularies where they make the formulations for the medications. And in some cases, they were billing for higher cost formulations, but giving lower cost formulations to the patients that came in for prescriptions. So billing for one thing that cost a lot more, but giving the patient like a lower version of the drugs. And so that basically went on for, I believe it was from 2000, let me look back again, from 2018 through 2020 was the period they were looking at. So usually with these things, if there is a key tam, like if there's a whistleblower or something, or once the government kind of gets wind of something, they're looking at past things. Of course, anything with the government, we always see when they put out reports and everything, they're always from like a year or 2 years ago. It's going to be the same thing, but because I've had people ask me before, why, are these old things, why aren't they looking? That's just the government's way of doing is that whole pay and chase thing that we've talked about multiple times that I never think is a good idea. It's just kind of, chasing your tail and doing more work. And while you're doing that, they're still continuing on with whatever wrong it is that they're doing. But that's the way our government works. So these are things from, time periods from before, like you said, this came out in January 2024, and the period they're looking at is 2018 through 2020. So, that doesn't account for the extra 4 years that they've continued to be doing this. So yeah, that always seems to me a little bit on the, I don't know, lazy kind of side of doing it, but that's kind of what they did here. The pharmacies separately also paid over 700,000 to settle allegations that the principal of the pharmacy was unjustly enriched as a result of billing Medicare and Medicaid from even further back, from 2015 through 2018, for prescriptions that, again, were billed for but never given to the patients. And y'all know, like, I don't know if y'all do it, but I do it. My prescriptions will come up for refill, and I'll go on to Walgreens and I'll say, okay, refill this one. And then, I don't go in that day to get them because I've got other things I'm doing. Sometimes it's like days later I'm doing. Well, when you're refilling and you click to refill it, the pharmacy is going to bill your insurance company for it. So if you never go in to get that prescription, that stuff's supposed to round back and go back in, to be paid back to your insurance because you didn't get the script. They didn't do it. So I don't know if some of that was going on, but it also seems that, obviously to this extent where they're getting busted for it, that, it's just they're billing people for things that, they never came in to pick up. They didn't give to them. So, you can't keep money for something that you didn't even give to the patient. So, the one case of billing the high and giving the low, that's, not good. And that's one thing, but like never even doing it and getting paid for it is, even worse in my opinion. So those are the two main things that they are alleged to have done. And then they did this settlement and had to go into, as you said, not a CIA because it's not as big. So they went into an IA, an integrity agreement with the government, to take a look at their practices and what they were doing for a while.
That's excellent, Betty. That's a great breakdown of what that DOJ press release stated. So, like we know, being humans here in America, having illnesses, sicknesses ourselves, just like you stated, I know I'm thinking back a few years ago, and I remember there was, a litany of prescriptions that I didn't actually end up going back to get. I preferred to just do it the old-fashioned way, over the counter, home remedies, whatever my rationale was back in those years, right? And so I remember getting those text alerts, those dings from my CVS, from my Walgreens, whoever I was using at the time, right? And you're absolutely right. What happens to those types of drugs, right? So if they're, again, erroneously being billed out, that's an error, because the patient, myself, I did not actually go and pick up any prescription, right? So technically they should have just sat there and not been sent over to the actual practice. So yeah, that's a really, really good point. These types of issues when, pharmaceuticals are involved, it's a complex procedure and process, checks and balances, which we'll get into as we take a look at the actual integrity agreement, right? They do list out a procedure. They spell it out in the integrity agreement, how the practice should improve their checks and balance process, because clearly, allegedly, in this particular situation, there was multiple failures for these variety of drugs that were listed in this DOJ press release. So things that you and I are well aware of, like metformin, was being allegedly abused, right? There was this Spiriva, there was Januvia, there was Vanoss type of a cream, as well as Biktarvy. So all of these big name drugs that people in the audience are aware of, and there are quite a few more, but they were, misappropriated, and the patients didn't actually go in and pick them up, use them, etc. Right? So there's just a lot of waste, a lot of fraud in these types of situations, and that's the number one priority of the OIG, right? Of course, the healthcare system here is massive, gigantic. And so I understand that it takes a long time for them to catch up. Again, like you said, this whole structure that's set up is, again, very confusing with all of this extrapolation from years past, right? So the general public might be like, wait a minute. If the press release was only right now in 2024, why on earth are we looking back and taking things away from years ago? But, under rules and regulations, the government is allowed to do that pursuant to all of these things. So, yeah, we here at Compliance Capers believe very strongly in compliance, especially proactive compliance, so you're not caught in these types of, very egregious situations involving multiple people, multiple entities, and things like that. So, yeah, I think that was a really, really good breakdown of what this particular DOJ press release was talking about. But as we dive into the actual nuts and bolts of this document itself, for the integrity agreement, it is, when you all take the time to take a look at it, again, it will be a little bit smaller than what we talked about in our very first episode, because that involved a corporate integrity agreement. So that was much heftier. This is still around a 31-page document, which we've had a chance to peruse about. But, it is a 3-year integrity agreement that they have all signed off on, from the OIG to the actual practice. So, it's really incredible when you take the time to review the structure of how it's written, and take a look that the fact that this integrity agreement that's signed off on for 3 years, that the practice will be looked at closely, everything is going to basically start in 60 days in terms of compliance requirements. So they're going to have 60 days, almost 2 full months, right, to get their act together.
Yep.
And follow the multiple steps that they have listed out in their compliance program requirements. So it's not as in depth as the CIA, but it is still a compliance program that is actually written out for them to be followed. So I think it's really unique. This is the first one that you and I came across that stated that the number one thing on the compliance program requirement that they have to do is put up a very public posting within 60 days at the practice of a OIG fraud hotline phone number. So that has to be very publicly posted, so the patient population, the staff, the personnel, everybody at the organization is aware of this new posting. So if there's any type of, fraud or misbehavior or capers that are occurring here, people can pick up the phone and easily dial the 1-800 OIG fraud number. So I thought that was really interesting and unique.
Yeah, kind of busting themselves out a little bit. I mean, it doesn't say they have to say, "Hey, we got investigated."
And no, it doesn't have to say any of that. No.
But just putting it up there to say, if you see anything, that whole big, if you see something, say something. Campaigns, as we see them going on for many different things. These guys are having to put this up in their pharmacies to say, if if there's something in here that's not right, here's the tips number for y'all to call to kind of, drop a dime on this pharmacy so we could keep a better tab on them. So I thought that was interesting too, and interesting that they put these things in here for this one at the 60 days. The other ones we've been looking at in the past capers this month have been 90 days. Like finding the IRO and things like that. They were giving them a little more time. So I'm not sure if that's because this is an IA and not a CIA, because it's not the corporate, so it's not the bigger. So maybe when they're the CIAs, they give them that extra grace period of the 30 days. I'm not sure, to be honest with you, but it was just something I also, in looking through here, that I kind of picked up on too.
Yeah.
That, they kind of shortened their timeline down a little bit.
Agreed. No, I'm glad you spotted that, because these are all questions, even though you and I have been around the block for a minute, these are the types of questions that you and I always have, right? Because we don't have anybody on speed dial from the OIG that we could just go and ask, right?
Or do we? No.
No. We know a lot of people, but I myself do not know anybody personally at the OIG that I could just be like, hey, this is a silly question, but
right.
Why? But that is definitely something that I think about, because, it's might be difficult to, find a IRO within this time period, right? But it is mandatory. They signed off on it. And so, I'm hopeful that they have taken care of it since January 2024, because their time has passed.
Yes,
so I hope they have come up with a wonderful IRO that will, help them facilitate the multiple compliance program requirements, everything in the appendices that has to be done swimmingly, in terms of the multiple things that were missed and that were found out by the OIG, right? In terms of their pharmacy claims review processes, all of those checks and balances that I was alluding to earlier, right, are things that the practice has to really understand, and the pharmacies have to understand how to better cleanly document the types of drugs that are being dispensed from month to month, how to quantify it, how to make sure that it's being submitted properly or not. Like we say, when we don't actually hit that, yes, we're going to go drive to the Walgreens and pick up our prescription, so they go into really, really fine detail throughout the entire document.
Yeah, I thought it was interesting in the document, when they list out this stuff for the independent review organization, or the IRO. If y'all are looking at the document, or when you pull up the document later, if you look at page 4, it starts where they start talking about, what the IRO is supposed to be doing. So on number 2, they just talk about the regular claims review. And we've seen that in our past CIAs and IAs that we've looked at. And of course, they are having to review the claims to make sure that they're continuing to bill, or that they're now billing in a compliant manner. But also the number 3 thing is, because of the billing for those high cost, high formularies, when they're giving the patients the lower ones, they also had to get a drug inventory review. So the IRO not only is looking at claims, but they're also actually looking at their inventory. So, they have to make sure that what their counts are, to make sure that what they're billing for, is actually what's being done. So they're going to do, from looking at it, a quarterly drug inventory review report. So, and that stuff all is spelled out in this case in Appendix C, because, as Sonal has explained on a previous compliance capers, they usually have appendices in the back of these IAs and CIAs that kind of go into a little further detail. So if you go into Appendix C, it's listing here, that's where they're kind of listing out the things that they expect to see in this quarterly drug inventory review report, that they're going to also need to be doing for the organization to make sure they're actually giving out the right drugs, and that the requirements here says it shall begin 30 days after the effective date. So that's even a shorter time period. They're like, we want on this right away, because of course the higher formulary things are also much higher cost in many cases than what they would be giving. Just think of it as like a brand name drug versus a generic drug. Getting the brand name is going to be a lot higher than if you got the generic form. So it's the same kind of thing, because of that dollar discrepancy. And some of these medications could be thousands of dollars. It's like, no, we're going to check on this like right now. So that's one of the things that they have to be doing right away. And they spell that out all in one of the appendices in the back.
I love it. That's spot on, Betty. That's a really great point that you picked up on, because a lot of those drugs that I had called out, they are very expensive name brands. They are name brands, right? So yeah, that's a really, really great point, that this particular integrity agreement wants the pharmacy to do things even faster, like you stated, within 30 days, right? Because our patients are going to be needing those refills within 30 days. So, their checks and balances have to also match. So I thought that was really, really spot on. And I think this is a really good roadmap. I know I've used that term throughout Compliance Capers. I do think this is a really good roadmap for internal proactive compliances in general, right? To document what is coming in and out of these types of entities, right? It's really, really good practice to know what's going on within your organizations. So I think it's a really, really good blueprint for these types of entities to use on a day-to-day basis. So this particular document does have 3 of those appendices that we highlighted before in a prior episode. There's Appendix A. They all have this for the IRO, for the Independent Review Organization. And like you stated, for Appendix B, for those pharmacy claims review. And then for Appendix C, for the Quality Drug Inventory Review. So again, those 3 are going to be very unique to this particular integrity agreement. Yeah.
Yeah, and you can also, oh, sorry, didn't mean to interrupt you.
No, it's fine. I just wanted to stress that, although we say from time to time that these are great to just take a look at and to try and follow the way this particular document lays out steps for you to also use, right? So you can develop your own internal policy based on this one, and then just plug in your particulars for your particular specialty compounded drugs, creams, etc. It's just a great idea.
Yeah. And, again, audit, internally, be looking at those things. But right. I just wanted to point out when you had said, how the appendix, and when I was mentioning it before up in the beginning part of the IA, when they're talking about laying out the steps. If you look, like in the Appendix C for the inventory, for the drug inventory, on page 1 of Appendix C, not only does it list out, it just, occurred to me as I'm looking through this, because I don't think we've addressed this before. Not only does it say what the entity that's in the IA has to do, but here, you can kind of see from the IRO's point of view what they're specifically looking at in their time periods. So if you look at Appendix C, the number 2, the quarterly drug inventory sample, it gives out days, timelines, like within 15 days, the first part says under A, following the end of each 3-month period during the terms of the IA, the IRO going to randomly select 30 scripts for which JSK has received reimbursement. And then they're going to select that 30 from using rat stats. And we've talked about that software before on compliance capers. So that's the government software that they use to prove that the sample is truly random and not cherry picked and not something that the pharmacy is suggesting to the IRO or giving them a list that, and the IRO will have to be keeping these. At least when I do audits for my clients, when I'm running the things in rat stats, because that's how we choose how to do our audit picks too, is that I keep those reports that I run through rat stats that shows here, these are the random numbers that were chosen. So if anybody questions it, we can say, okay, here's the whole universe of the claims, and here's the one that rat stats chose. And if you go count yourself, you can see that it truly met the random, and we were picking the ones that rat stats pointed out to us and told us to pick. So that was something else interesting that I just wanted to point out, that it also kind of lays down that roadmap for the IROs too, and gives the specific dates of what they're going to have to meet for all of those things.
Yeah, that's another great highlighted point that we did not discuss on previous episodes, right? It's really incredible that our practices and providers who happen to be tuning in this morning to Compliance Capers needs to understand that's the greater why behind these IROs, right? They have to understand how to utilize this very old rat stats system, but it is a government program, and that is what they use, which is why they want IROs to be very user savvy in how to use the software program, be able to download it, understand the directions, how to make sure that what they're choosing in terms of samples based on their directions are actually valid and actually randomized and not cherry picked. It can't be technically a convenience type of a sample in this type of a IRO situation. It has to be considered random. So we could digress into a whole other topic, another conversation for, the auditing sample, but that's not what Compliance Capers is talking about today. But that's a really, really good point, that when you take the time to read these types of integrity agreements, it is a roadmap, and they will tell you what software this IRO has to use. It is spelled out. You cannot just use a convenience sample based on whatever statistician you're using and they're saying, no, this will be fine. No, in fact, it won't be fine. You have to use rat stats. So yeah,
and the software is free.
Good point. And it's free.
So yep. They don't have to, it's not anything they have to go purchase or anything like that too. So anybody that's watching or listening, it's something that y'all can download and be using it in your practices. If you want to do a truly randomized thing, is to run it through, and it just, you put in how many you want, how many you have, and it'll say, okay, then you take number 5 and number 400 and number 20, and and then you just kind of follow along what it says. I just love with the software. Yeah, I mean, it really, you're right, it really is old. It's old. But when you save it on your desktop, it has that big rat when you go to use it.
Rat stats. Literally, there is a rat. Yes, they have not improved the imagery on the icon. It is still a cute little rat, or an ugly rat, like, but whatever.
I know. It looks like it's from a bad 80s video game.
Video game. It does. It's very.
It's very stuff.
That's right. This is just our opinion, but yes, it is really old looking, the icon. But yes, it is a very old software program, which is why we're saying it's a bit clunky to use, because you and I are very savvy in the new technology. But we're also forced to be very friendly with this older stuff as well. But yeah, that's a great point. that it is outlined in these appendices for what the IRO actually has to do. And this particular one is very unique in that it really does want those claims reviews to be used in this particular fashion, and really, really quick. Like we had said, within the 30 days, things have to get started. So, yeah, I really liked this particular integrity agreement, again, because of its uniqueness. And also it just went into highlighting, the several decades worth of issues we've been having in this particular space, in terms of fraudulent, compounded creams and things like that have been in the news, for the government types of TRICARE, CHAMP VA, all of this patient population, which is so vulnerable. And it's just very, very sad that there are these types of unscrupulous folks who can also do these types of things. I'm not saying that this entity was doing things unscrupulously, but in general, these types of really, really highly reimbursed types of drugs are going to be at risk here for the Medicare population.
Yeah. It, we can't, you can't tell from the integrity agreement announcements, just like with the what was the one we did? Was it last month? The self-disclosures, or 2 months ago? Like with the self-disclosures, they really give you like nothing,
Right.
And with these IAs, I think some of them, they kind of think, I don't think if they didn't think something unscrupulous was going on, they wouldn't make them get into an IA or a CIA. So it was like, if you didn't know, you knew something probably wasn't quite right, but you went ahead and continued to do it anyway, probably because, the money was so good. So, you like turn that blind eye kind of thing. And they weren't, and they entered into the IAs with them. I think if they thought it was blatant, like you knew and you were just purposely just running this as long as you could, there wouldn't be they wouldn't be CIAs or IA. They would be finding them and they would be putting them in jail and giving them, all of that other kind of stuff, pulling their licenses. And, so I think these are, so they don't really come out and, push too hard in. They're saying this is wrong, this shouldn't be done, and we have to protect Medicare and Medicaid, and they kind of give all the little speeches the DOJ does, when they enter into these things. So I kind of think like you did, it was more maybe on the, we didn't know how bad this was kind of thing. But I think the billing for the higher, giving the lower one, that's hard for me to believe they didn't know that one. But the piece of billing and then the patient not picking it up, that I'm like, well, maybe it's something in the software they didn't have good setup, or they didn't have good checks and balances. Once again, like you were mentioning, and as we mentioned again, if an audit had been done, during any of this time, it would have been like, hey, we have all of this, but nobody's ever come and picked these things up, so we shouldn't be keeping this. That part of it would have been caught, but that just kind of pushes out there that whole thought of making sure that you're looking at yourself internally, whether it be you personally with your own staff, or enlisting a healthcare consultant to come in and take a look at these things, that you're checking on things in some manner at least once a year. I have a lot of my clients set up to where we're doing things quarterly. So that way, if something steps out of line, you can catch it right away and pull it back in. Or if they're missing something, we can catch it right away and they can start getting paid for things, but just to leave things go and say, well, if we don't hear, we're getting paid. That's the other one I love, where we're getting paid. that doesn't matter. You can get paid for anything. It's keeping what you got paid. Did you get paid correctly? Is it compliant? That's the part that, everybody in the practices needs to keep an eye on, because you can get paid. Getting paid means nothing. It doesn't mean it's right. So the important part out of, these things that we're talking about is the fact that you want to make sure you keep it and it's right, because it's just going to cost you more to pay back, because then you've got penalties and fines, and they want interest on the money
Mhm.
that you had that you shouldn't have had, that was theirs. But it just opens up a whole can of worms for stuff. So yeah, keep an eye on your stuff, y'all. Look at your stuff. I recommend once a quarter, actually, to make sure you're checking something. Just get an eyeball on it.
Couldn't agree more, my friend. Could not agree more. That's absolutely spot on. This is why we do compliance capers. We believe strongly in our practices taking a close look at what they're sending out from a monthly basis. It's quick. It doesn't have to be, hundreds of records in a month that need to be reviewed. A really focused audit can catch things quickly. That's things that we love to do with our clients, right? Our focused audits that are particular to whatever weaknesses they have, to whatever is in the news from the OIG, because we have a vast variety of providers who do provide these types of hot button service lines. And so those types of things do need to be looked at closely and monitored and audited, often, because as soon as you and I identify an issue, it can be quickly corrected. Because if things are ignored, like these types of practices here that we talk about on compliance capers, if these things are ignored, not addressed, simply brushed under the rug, overlooked, et cetera, it's not going to be a good thing in the end. Like we state from month to month, whatever our hot topic is, but it's a hot topic because it's on compliance capers, right? And it's because they did not do the auditing services, the monitoring services, these main functions of a compliance program. Are simply
and it's not going away.
And it's not going away. They're only going to, in fact, fun fact with our crystal ball, there will be a even deeper physicians compliance program document that's going to be coming out here within the next few years by the OIG. They're already working on much more than just what they issued in November of 2023 for the general compliance program. They're coming out with at least 2 more this year in 2024. So, the OIG is really ramping up the fact that all of these various specialties and all of these various entities need to develop their own. And what are they doing? They're helping you by developing a roadmap for you. So,
on the website, they have all that stuff where you can go on the OIG website and list out the toolkits and things like that for compliance programs and staying compliant. I do a talk where I go through, and I think we've talked about it before, maybe on Healthcare Happenings, I'm not sure, but where we went through like all the things on the OIG site and all the specific things under compliance and under releases and under, I mean, just a wealth of information that's out there, and it's all free. So go out to the OIG website and dig around and see all the stuff that they have. They have a lot of good information out there for people. You just have to take the time to, go through it and see what's out there and what applies to your practice.
That's right. Absolutely, Betty. Yeah. Well, this is our passion, clearly. If you guys haven't figured that out, from month to month, we love talking about compliance. We believe in it wholeheartedly. So I hope this week's episode really got you guys more interested in taking a deeper look at these types of integrity agreements that are available to the public. Hopefully you guys will peruse through these links that I provided for you when you have more time on your hands. But I know we have our final episode for the month. That's going to be next week. So I'm looking forward to wrapping up our month on corporate integrity agreements, because I think we've talked about a lot of different specialties, entities, etc. And I think, again, these types of documents and press releases are really, really informative to every compliance professional that's in the audience. I think it's really, really useful information. So I'm looking forward to next week with you.
Yes, another good pick for this week, Sonal. It's good. You know, we're picking different things and kind of giving different shades, and we'll keep it rolling for next week.
That's right. All right, my friend. Well, I'll see you then. Thank you.
Thanks, y'all. Bye.
All right. Bye-bye.